Good afternoon. This is WLBT's Ask the Experts live from the Hub. I'm your host, Kelly Boyd, and joining me today is Dr. Sheehan of Baptist Cancer Center. Welcome to the Hub.
Thank you for having me today.
Thank you for being here. We're going to talk about lung cancer today.
That's
so
right.
Tell everyone your specialty at Baptist Cancer Center.
I'm a medical oncologist at Jackson Oncology Associates, which I see clinic patients at Baptist Cancer Clinic. And as a medical oncologist, we give treatment to cancer patients in the form of chemotherapy, immunotherapy, and targeted therapies. And we kind of are the overseers of their cancer, whether if we need to ask another specialist to help us, such as our radiation doctors or our surgeons. We're kind of the overseers of our patients.
Okay. Good to know. All right, so as I said, we're talking about lung cancer,
right.
And we have questions from our Ask the Experts page on WLBT.com. But if you want to chat with Dr. Sheehan while we're live on Facebook about lung cancer, please ask your questions while we're live. All right, so first of all, what exactly is lung cancer?
So lung cancer is cancer of the lungs, and those are the two large organs in our chest. And they help us take in oxygen and release carbon dioxide in the form of waste. And so lung cancer is the second most common cause of cancer in both men and women, behind prostate and breast cancer. And unfortunately, it's the leading cause of cancer death in our country.
So second in both men and women after prostate and breast.
But the leading cause of cancer death.
Death.
So over 140,000 patients die each year of lung cancer.
Wow, okay. What's the average age at diagnosis of lung cancer?
So 70 years old is the average age. Most patients are over the age of 65. However, we do see younger patients at certain times as well.
Okay, yeah, so 70, that's a little bit later
in life,
and
usually related to smoking, and so we see that kind of as an after effect later on in life.
One of your colleagues has mentioned before people could have stopped smoking 20, 30 years and then find out at age 70 that they do
from the after effects of that.
So that's pretty common.
It is pretty common.
That's the average age. Wow.
Yes.
Okay. So what are the two main types of lung cancer?
So I kind of think of it as two large umbrellas, and we have the non-small cell lung cancer side of things and the small cell lung cancer side.
Okay.
And so under the non-small cell lung cancer, this accounts for about 80 to 85% of lung cancer, and there are several types kind of under that large umbrella. Which includes squamous cell cancer, adenocarcinoma, and large cell carcinoma. And incidentally, adenocarcinoma is the most common cause of lung cancer in non-smokers, whether it's from secondhand smoke or some other chemical they were exposed to, or even sometimes we don't even identify a risk for that patient.
Wow.
And then the other large group is our small cell lung cancer, and that's about 10 to 15% of lung cancer.
Okay.
It is usually more aggressive and usually diagnosed at a later time or later stage than non-small cell lung cancer. And what's important about looking at the two different types is they're treated very differently.
Okay. Very customized forms of treatment.
Yes,
and
it's important to know what pathology they have because that tailors the treatment that we give.
Okay. All right. Next question is, and it has an acronym. I'm going to guess that it stands for, you just talked about non-small cell lung cancer, right? So it says what kinds of treatments are available for non-small cell?
So treatment really does depend on stage at the time of diagnosis. In general, this may include surgery, radiation therapy, chemotherapy, immunotherapy, or even targeted therapies. And in some patients, we may even combine those modalities to treat them.
Okay. All right. And what about small cell?
So small cell, like I said, is important. Its stage is very important for that as well. Chemotherapy is the mainstay of treatment for small cell lung cancer. We kind of talk of small cell lung cancer as limited or extensive stage. And in limited stage, we combine chemotherapy with radiation to the area of cancer. And in extensive stage, chemotherapy, and recently a new drug was approved that is an immunotherapy that we add to the chemotherapy.
Okay. Wow. Always progress is a good thing.
Yes.
How is lung cancer staged?
So at the time of diagnosis, we will perform imaging, meaning the medical oncologist will obtain a CAT scan or a PET scan to see how far the cancer spread or if it's spread to other areas. And so staging is important because it includes how big is the tumor, has it gone to other areas to include other lymph nodes, or has it traveled to other distant organs. And so in non-small cell lung cancer, we speak in stage 0 to 4. The lower the number, the lesser the cancer. And then in small cell lung cancer, as I said, we speak in terms of limited stage and extensive stage. And in limited stage, we're talking about cancer that is confined to an area that we can give radiation and chemotherapy to together. And extensive, that's widespread disease, meaning spread to other organs, and we treat with chemo.
Okay. All right. A lot of information on staging lung cancer. Okay, we have a few comments here. Jaworski Trevelyan says that he really enjoys the hub. Well, thank you for joining us and for watching these.
Yeah, thank you for joining us today.
Hope you're learning a lot. Any questions about lung cancer? And Dr. Justin Turner says, Dr. Natalie, represent. I know Dr. Turner.
Yes, Justin. Justin and I trained together at a period of time. You know, we all do internal medicine prior to our specialties, and so thanks for that, Justin.
Awesome.
I appreciate it.
Hey, thanks for joining us. All right. Next question. If a patient has stage 4, I won't say it has the acronym on here, but that is non-small cell lung cancer.
Right?
What does it mean if my doctor orders tumor testing?
So first, remember, stage 4 means it left the organ of origin, our lungs, and it traveled to distant organs, meaning it could have gone to the liver or to the brain or to the adrenal glands, just to name a few. And so if that's occurred and we know the patient has a stage 4 non-small cell lung cancer, we perform testing to look for certain gene mutations, and these may include EGFR, ALK, and ROS1, and it's important because it helps us guide therapy for those patients, and we're going to get there, I promise. So
it's like we're getting a real lesson. Anyone that's in college studying biology or anatomy,
it really does make a difference.
Could really go back and watch these videos.
Exactly, exactly.
Okay. What is, and you're going to have to tell us what an EGFR inhibitor is, but what is an EGFR inhibitor? Okay, well, it's asking what is it and when is it used?
So EGFR stands for epidermal growth factor receptor, and it's one of those mutations that I just said we tested for on pathology of patients with stage 4 non-small cell lung cancer. And the importance of this is if it's positive, then we can treat those patients with an inhibitor of EGFR and, you know, stop their cancer from growing and kill the cancer cells.
Wow. And did you say that was through the skin?
No, so that's pathology. So their tumors actually tested for that mutation.
Gotcha.
At the time of diagnosis, we send off those studies. Our pathologists are very good in helping us do those things for our patients.
Okay. Yes, y'all have a big team of resources there at the Cancer Center. What is now is this ALK or an ALK inhibitor?
An ALK inhibitor. So just like I said, the EGFR, ALK is another mutation that we look for on the tumor. And if those patients have an ALK mutation or rearrangement, then we're able to treat them with an inhibitor of that mutation as well and block cancer from growing.
Great. Okay. All right. What if my tumor tests high in PDL1? And what is PDL1?
So PDL1 is programmed death ligand 1. And so what's important about this is, so we also test for this on a patient's tumor if they have stage 4 non-small cell lung cancer. And if a patient tests high for this, then they could be a candidate for immunotherapy.
Okay. You mentioned immunotherapy earlier, so the next question is, what is immunotherapy?
So it's a type of treatment which asks our immune system to attack the cancer. Okay. And so cancer cells have proteins on the surface of their cells that actually tell our immune system to turn off. And so with a drug to PDL1, we're able to block that interaction and let our own immune system take care of the cancer. It's pretty cool.
Wow, that's very cool. Yes. Very cool. Okay, what about targeted therapy? What is that?
So for a tumor to grow, tumor cells have to have blood vessels. And so targeted therapy, and so another form for that is called angiogenesis, is a fancy term for blood vessels growing in those tumors. And so for targeted therapy is a type of monoclonal antibody, the drug we use in advanced non-small cell lung cancers, Avastin or bevacizumab. And so what it does is it blocks proteins or binds to the proteins in the cancer cell and does not allow them to make those blood vessels so they can live and grow. It actually kills the cancer cells as well.
Okay, so it makes its own little blood vessels.
And so to block that, we have special drugs.
Wow.
Which is awesome.
Yeah, it really is. Okay, what are some of the side effects of this targeted therapy?
So targeted therapy has a different set of side effects, and so we have to be very mindful as medical oncologists about those side effects.
Sure.
So hypertension or high blood pressure is one of the known things that targeted therapy can do, and so even if a patient has not had high blood pressure, they may develop high blood pressure on the medication, or if they do have it, it may make their blood pressure worsen. Some other things these drugs can do as well is fatigue, headache, or diarrhea. And then there are some serious side effects of those drugs, including blood clots. It can cause bleeding. It can very much impact wound healing. And it can do something called GI perforation, where it can make little holes in our GI tract, which we don't want that to happen to our patients.
Don't want that, I can imagine. All right, what is chemotherapy?
So chemotherapy is
big one that
the big one that you hear a lot about, because all the other things are very new.
Right.
So chemotherapy is anti-cancer treatment that we can give either orally or intravenously. And so once that gets into the bloodstream, it travels to most areas of the body to treat the cancer. So there can be side effects to that, such as hair loss. We can have nausea, vomiting, diarrhea, infections. So patients are more prone to infections because when they receive chemotherapy, their white blood cell count goes down, and fever. The immune system's a lot lower. And so those are common things that can happen with chemotherapy.
Okay. How often is treatment given, and how does the oncologist monitor response to therapy?
So treatment is given in what we call cycles. And so in general, most cycles are every 3 to 4 weeks. The patient comes in, they may get a treatment, and then the treatment's not for another 3 weeks or 4 weeks, depending on the medications that your oncologist chooses. And so for most advanced disease, treatment is usually given 4 to 6 cycles, and maybe followed by a maintenance treatment, depending on how the patient responds initially to those 4 to 6 cycles. And so what do we do to make sure that the cancer is responding to our treatment? We do a PET scan or a CAT scan, and that's our way of monitoring whether disease is improving.
Gotcha. All right. Is there a way to minimize side effects of treatments?
So we as oncologists are very mindful of side effects in our patients, and so we have anti-nausea medicine, anti-diarrhea medications to help minimize those things. We also have 2 medications. One is Neupogen, one is Neulasta. At times, we can give these to patients to prevent their white blood cell count from falling and putting them at risk for fever and infections as well.
Okay. How can a patient lower the risk of cancer coming back?
Well, obviously with lung cancer, if the patient's smoking, quitting is important.
Yes.
A lot of people ask us about diet in connection with diet and their cancer, and there's just not a lot of great evidence with lung cancer, and not a lot of great studies of patients who have lung cancer and certain diets. I always just tell you to talk to your own oncologist about that. But one thing I do want to say is dietary supplements are not regulated by the FDA, so they don't have to be proven safe or efficacious. And so I always say be mindful of speaking with your oncologist about those things so they know you may be taking that. And I don't want it, like with my patients, I don't want that to interfere, say, with their chemotherapy and cause them even more side effects.
Okay, so that's supplements, such as vitamins.
Absolutely. You know, things that are over the counter that may be promoted to help with things, but maybe actually hindering a little bit with the chemotherapy.
Yeah, be sure that your doctor, your oncologist knows it's part of your treatment plan.
It's part of what you want to do to help keep yourself healthy.
Okay, good. All right. Can I continue working or going to school during treatment?
So I encourage my patients to stay active. Obviously, it depends on the patient's stage, what their state of health is when they're diagnosed, what kind of work they're doing at the time of diagnosis, and then the actual treatment plan with you and your oncologist are all very important. So I talk to my patients and we formulate a plan going forward. You know, if I start to do these things and I can't, you know, what are we going to do next?
Right.
And so just encourage you to talk to your oncologist.
Right. And you guys have a lot of support staff at Baptist Cancer Center as well that can help. And even, I believe, like as far as psychologists, psychiatrists, and people that help with the family.
We have great support staff. And so we have Cancer Center navigators.
Right.
And so they are a point of contact for family and for patients. So they can get certain information for the patient and just kind of help them, guide them through the process. We have cancer orientations that meet, and so it
like
gives
twice a week.
and it gives an overview of treatment and what patients and their families can expect, and the services that we do have to provide. And then we also have support groups that meet periodically, and those are listed on the webpage.
Okay. I think that's actually part of the next question. Are there resources like a support group that might be useful for someone with lung cancer?
Yeah, and so our cancer navigators, our orientation, you know, our support groups are all great things that we have there at Baptist.
We had Adrienne. I can't remember Adrienne's last name. I just know her by her first name, but she's the breast health navigator.
She is, and so there's like several navigators for each, you know, solid tumor and type, and so they help us with our patients specifically for those types of cancers and get them the resources that they need.
That's great. So there's a set of lung navigators in addition to, because I've met the breast navigators.
And so each one of them has a certain thing that they help with.
That is really awesome spectrum of care that you guys have to offer. Yeah. It's great. All right, I don't see any questions over there. How can our viewers find out more about you, Dr. Sheehan, and Baptist Cancer Center?
So they can go to the website, baptistcancercenter.com.
That's right.
And so they can go there and find out more about me as my job at Jackson Oncology. And also our phone number there is 601-968-1049.
Okay. And let's see, I don't see your next episode listed. Uh-oh. We might have to update our upcoming schedule on the Ask the Experts page, but you can go there and send questions for our next episode with Baptist Cancer Center and for all our experts. Thank you so much for being here today and telling us lots of stuff we didn't know about lung cancer.
And thank you for having me anytime.
Thank you. And thank you all for your questions and for watching WLBT's Ask the Experts. Have a great day.